This podcast is on FUE or Hair Transplant Anesthesia. I was working on a lecture for a course at the Global Hair Loss Summit coming up this fall, doing a presentation for that. I also wrote a chapter in my new textbook on FUE that's coming out next year in 2021. And I thought, I really should just talk a little bit about some anesthesia principles. The techniques are incredibly exhaustive. My chapter was about 40 typewritten pages, so of course I'm not going to get into those levels of details, but I want to talk about some principles of what makes good anesthesia. The first one I'm going to start with is safety. Just last week I had a hair transplant outfit said the patient had some problems during the surgery, and they says, you should really go to see Dr. Lamb to do the surgery because it's safe over there. And really, the reason we are much safer, besides going through all the clearances and making sure that we elect to have patients very safely cleared medically, chosen correctly for surgery. I also operate in a Joint Commission accredited facility, which allows us to do proper sedation to minimize discomfort. And also it allows us to perform very, very safe surgery because we have all the emergency protocols. Of course, nothing is 100% safe. You can never promise that. But 99.9% of clinics out there, I would say, are not in an accredited facility. They're just doing things in an office setting, which I think can be risky. I always like to have the highest standard possible. And I think I did a podcast actually on accreditation. You can listen to that. But so the first principle is working in a accredited facility. Second is having proper sedation and emergency equipment for any problems, making choices that are wise, having infrastructure for that. But then getting down into the details of actually anesthesia is a lot of places they do what's called a ring block to start and just anesthetize it with the needle that goes around the scalp. Well, first of all, I was doing that for many years, and patients were even feeling it because I have sedation that's very different. But now I'm always taking things to another level. So I'm doing what's called a nerve block, and these little tiny nerves, if I block them, actually make the entire anterior scalp numb and the posterior scalp numb, and so that by doing that, it makes patients have a significant lower level of discomfort. That is a huge thing, but a lot of places don't do that because they don't know where the nerve anatomy is, and that requires someone who, and that's my background as facial plastic surgery. Actually, one of my editors in my book said, "Wow, Sam, I'm actually almost intimidated by your chapter because it goes through so much detail that that I think most hair surgeons don't even practice or even understand." So it really is a requisite knowledge of understanding anatomy to deliver painless anesthesia. The other thing that I do is a vibration technique, and vibration is that our brain can either perceive pain or vibration, only one signal at a time. So if I'm overwhelming your brain with a lot of vibration, you should not feel very much discomfort. I do that for all my techniques, whatever I'm doing anesthesia-wise. That makes a big difference. The other technique that I do for the back of the head is something called tumescence. It's a very, very dilute, long-lasting anesthetic, and somehow it makes no sense, but the more dilute the anesthesia, which also adds safety, with a higher volume will actually last significantly longer and hurt a lot less. So I use a field tumescence for the donor area that really works well for my patients. I do the same thing when I'm doing beard FUE harvest. So again, I'm not going to get into really the details of how I do the anesthesia because again, it could take me, I could read my whole 40-page chapter, but I think I just want to go through some of the principles that make what I do different than other places. And make you feel to understand that this involves safety, comfort, and effectiveness.